Showing great restraint, not whistling. I've been told by many people, Mary, you're just not a good whistler, so I'm not going to whistle every time I hear that song. You have my word. I am so pleased to have a chance to talk to direct from Bristol Hospital Counseling Center. They have such amazing specialties, services, professionals over at Bristol Hospital. Do check out their website, by the way. It's bristolhospital.org. It has so much valuable information on it, and I'm so pleased to welcome to our show. He is a psychiatrist with Bristol Hospital's Counseling Center, Dr. Jeffrey Shelton. Doctor, good afternoon.
Good afternoon, Mary.
How are you today?
I'm doing well, thanks.
Oh, thank you so much for joining us. I've been so looking forward to talking with you, specifically about something that you spend as a psychiatrist, spend your day with. I have been reading and hearing so much about it now that we're into the month of December, into the holiday season, and that is depression.
Right.
Unfortunately. So I'm gathering, Doctor, the fact that and I'm sure other people have been hearing so much about it, it must be not uncommon.
You know, unfortunately, you're right. Yeah, it is a fairly common condition during the holidays to feel depressed. And I think there's probably lots of factors that contribute to it, but I really think probably one of the more common ones is the stress of the holidays. You know, it tends to be a very stressful time for lots of different people, and research has shown what really all of us have known for a long time is that stress can cause depression. And so I think that's really kind of what's behind the increase of depression with the holidays.
You know, I will ask you in just a moment in terms of some of the signs that we should look for and how we can really either help ourselves or someone else that we suspect might be dealing with depression. But when you just mentioned in terms of it being not uncommon over the holidays, are we talking about clinical depression? And if so, is that something that is very short term, or is that, you know, once you have clinical depression, you tend to have it for a while?
Right, and I think that's a very important distinction between just, you know, feeling blue for a few days versus it kind of evolving into a kind of major depressive episode. So it can just be kind of the winter blues that are somewhat mild, but unfortunately that also can progress into a pretty serious mental illness.
I was talking just this morning, Doctor, with someone who happens to be about 50 years old or so, and he's a single man, and he admitted that he was beginning to feel, he called it the blues, because the upcoming holidays, and
right.
Both of his parents are passed, and he's not married, and so on and so forth. So that's what we're talking about in terms of holiday depression.
Right, exactly.
So what are some of the signs of someone who might be depressed?
Right. Well, I think one of the great challenges in working with people who are depressed is it can be very subtle and very difficult to know. But what I normally tell people is that depression really is a loss of vitality, that the opposite of depression is not happiness, but it's vitality. And so one of the things to look for is how is that person's vitality? Are they doing the things that they normally do, that they normally enjoy? Are they going out with friends, or are they isolating, not going out? That type of thing can be kind of an early warning sign for worsening depression.
Well, isn't that an interesting distinction that you just made that I had never heard before? You know, that the opposite of depression is not happiness.
Right. Actually, that actually came from a book called The Noonday Demon. The author is Andrew Solomon, and he actually made that distinction that really the opposite of depression isn't happiness, that it's really that loss of enjoyment and energy for life.
And that's just a different way to look at it, isn't it?
Right.
I like that. You know, I'm getting off subject for just a little moment. Speaking with psychiatrist from Bristol Hospital, Dr. Jeffrey Shelton, joining me today to talk about depression over the holidays. But, you know, we like the personal stuff around here, Doctor.
Okay.
So I'm curious, why did you choose psychiatry as your specialty?
You know, when I started medical school, I did not intend on becoming a psychiatrist. I was looking into doing more of a primary care, family practice, but I really fell in love with psychiatry during my rotations as a medical student. I was really touched by the patients and their stories, and found that what I really loved about medicine is talking to people and hearing what's going on. And so I think it just ended up being a good fit for me.
Isn't that wonderful? Isn't that wonderful? Is it a specialty, and then we'll get right back to depression over the holidays, that I always like to think of different specialties in the profession of medicine, doctor, and how they've changed over the last 20 years or so. I suspect that your specialty has a lot in terms of medications. Right.
So I think classically psychiatrists did more type of psychotherapy type of work, and that, we're going back, several decades. But you're right, over the course of the last several decades, it's become more focused on medications and that type of thing. But that being said, psychotherapy was a large part of my training, and it is part of my job currently. So we try to do it all as a psychiatrist, I guess.
I'm sure you need to. Absolutely. Dr. Jeffrey Shelton. So getting back to holiday depression, if someone is aware or concerned about a family member or a friend who might be depressed, what should that person know? What should that person do?
Right. I mean, I think the first thing is what, really kind of the main thing that we do here at the Counseling Center is just to talk to the person, to get them to open up about what's going on, how are they feeling, what are they thinking about. So I would say the first thing is just to listen. People generally don't need you to solve their problems. What they really need is someone to talk to who will be empathetic to how they're feeling and their struggles. So I think that would be the first thing. And the next is that if they really are struggling and it's becoming more severe, then to definitely get them help. I would definitely seek a psychiatrist to see and talk to them more about what's going on.
I'm just thinking of a scenario, doctor, that my guess is you hear a lot about from family members of patients and friends, and probably a lot of people can relate to. If someone is talking to their brother, cousin, nephew, neighbor, friend, and that person is sounding very depressed and just wants to stay home, just doesn't want to participate in holidays, just wants to stay home by themselves, how do we know whether we should push that person or not?
Yeah. I think it's the best thing, like I said, is to talk to them, try to kind of develop a sense of trust and rapport with them, and try to understand, hey, what's going on, what's happening now that you're choosing to do that, and to hear what they have to say. I mean, people change out of relationships. People develop problems sometimes through relationships, and they get better through relationships. And in psychiatry, what we've learned is that the most important thing for me is my relationship with my patients, and that's how they get better, is through having a trust with myself, with their therapist. And I think the same thing is true in that circumstance as well. It's just to kind of focus on that relationship and try to develop that bond and rapport.
I love that answer, and that was kind of a loaded question, and in part, I'm sure, because every situation is, of course, different.
Right.
So that again speaks to the fact that if we are concerned, to really hook them up with a qualified professional such as yourself.
Right.
That really is the best thing to do. Is depression, doctor, is that something that should be considered dangerous?
Absolutely. Yeah, absolutely. Depression is now considered to be the number one cause of disability worldwide. And, the feared outcome that we all work so hard to prevent with depression can be suicide, which is now it's in the top 10 leading causes of death in this country. And actually here in Bristol, we actually have a fairly high rate of suicide, tragically enough, and something that the hospital has been working very hard to develop programs to try to meet the needs of our community. But it can be very serious. And so, but that being said, treatment does work. And so, the best thing is just to try to get that person some help.
Absolutely. And again, speaking with Dr. Jeffrey Shelton, psychiatrist with Bristol Hospital Counseling Center. Their website, again, is bristolhospital.org. When you mentioned the statistics across the country in terms of suicide is in the top 10,
right?
Is that what you mentioned? Is there a particular age that is applicable to, doctor? I'm just curious.
Right. So the highest risk demographics are actually older Caucasian men tend to be the highest risk from dying from suicide. Men tend to die from suicide more commonly than women. Women generally attempt, but do so through less lethal means, such as an overdose. Men might use something such as a firearm or something to that effect. But yeah, there definitely are risk factors for suicide, things like chronic pain, chronic illness. Substance abuse is probably one of the most important risk factors for suicide, and definitely also something to pay attention to, because that's definitely one of the highest risk factors for suicide. Yeah.
Oh, my goodness, Doctor. Are you from Connecticut originally, by the way?
I'm not, actually. I'm actually from the West Coast.
You are? Oh, yeah. Well, Bristol Hospital is lucky to have you.
Well, thank you. That's very nice.
Lucky indeed. Dr. Jeffrey Shelton, psychiatrist with Bristol Hospital. Anything else about holiday depression that comes to mind?
You know, what I tell my patients is just to not forget their mental health during the season, to make sure that they're setting aside time in their very busy holiday schedule to nurture themselves, to do things that they feel rejuvenate them, and to make sure that that's part of the holidays. And to set reasonable expectations for yourself. You know, don't go overboard with finances or overcommit yourself that way, but just to make sure that it's also a time of kind of taking care of yourself.
I love that. You're not aware of this, but I've been doing on my show, Doctor, for about 6 years now what I call a monthly challenge. And I just, before you joined us on air, kicked off my December challenge, which is to perform a random act of kindness.
Oh, that's great.
For yourself.
Oh, brilliant.
Isn't that a great one, Doctor? Yeah. And it really echoes somewhat what you just said. Yeah, isn't that too funny? So that's what my challenge is for everyone this month, and we'll be talking about it throughout the month, and folks will be calling in and sharing their experiences and insights and ideas. So I love that you and I are having this conversation.
Yes, that's wonderful.
Oh, that's terrific. Dr. Jeffrey Shelton with Bristol Hospital. Website again, bristolhospital.org. Could you please share a phone number into your counseling center, Doctor?
Sure, yeah. The Bristol Hospital Counseling Center, the number is 860-583-5858. 583-5858. And one does not need to live in Bristol to call your counseling center. Nope.
I know that for a fact.
Always, yeah.
Yeah, terrific. Doctor, thank you so much. Would love to have you come back to the show.
Thank you so much.
Thank you so much for joining us, and have the happiest of holiday seasons.
You too. Thank you.
Thank you, Doctor. Isn't that was not planned. I tell you, he and I have never spoken before, but isn't that so great that he was talking about doing something nice for yourself when that happens to be my December challenge for you, to perform random acts of kindness. That's not a new thing. We hear about that, read about that. People talk about that in the media all the time. But we're talking about performing a random act of kindness for yourself. See, that's the unique little twist we got going on here. We'll take a break. We'll be back. Open phones when we return. 1-888-574-2723.
You're listening to The Mary Jones Show on the Talk of Connecticut.